Now let's get more on our top story with a big New Year spike in Omicron cases putting pressure on hospitals. It comes as the booster vaccination program is set to be ramped up from tomorrow and a week before vaccinations open for children between the ages of 5 and 11. Leading epidemiologist Mary-Louise McLaws, who's a member of the World Health Organization's COVID-19 panel, joins us from Sydney now. Good morning and Happy New Year to you. But let's talk about the COVID numbers. They're high numbers, but so are the hospitalisation numbers. They're rising too. How concerned should we be about both of those figures?
Good morning, Isk. We should be concerned, but what would help is if the government gave us an idea of those in hospital, how many or what proportion are Omicron, because the latest weekly surveillance that went to the 11th of December in New South Wales. They haven't done one since then. The majority of cases of Omicron were in the young, under 40. So perhaps that increase in hospitalisation has been mainly due to Delta. It's very difficult to know because don't forget there's normally about a 10-day delay in as cases start to increase, so do hospitalisation. But I'll just remind you, yesterday we had an over 200% increase in hospitalisation. It was nearly 300% increase. So that could have been due to Delta alone. So let's hope it wasn't due to Omicron and that Omicron is truly a milder infection and caught at the moment mostly by the young.
Do you believe that the figures are accurate? I mean, we've had testing problems and testing delays, and a lot of health staff, testers have been given breaks as well. These numbers are high, but could they actually be even higher? Are you concerned about that?
Well, certainly the numbers of cases could be higher. The hospitalisation won't be. They're potentially very accurate. I do know that the New South Wales Health Department were thinking about trying to keep people at home rather than go to hospital. And if they have a mild case, even if they're 65 years and younger instead of 55 years and younger, they'll stay at home to try to potentially give more beds to other infections, but also for those that really need hospitalisation. Certainly, the testing is an enormous problem. So we won't know where the hotspots are. And even if Delta appears to be milder at the moment Omicron is milder than Delta, we still won't know when there are hotspots, where they are, and whether those hotspots are with Delta, because you don't want to walk into getting a Delta infection. Certainly if you've had a booster shot, you're less likely to catch Delta, absolutely. You're potentially probably likely to still get Omicron if you haven't had 2 weeks since your third dose, because that 1 to 2 weeks after that third dose certainly gives you a nice time to get that maximum immune response. So absolutely we need to have more testing done. And I was really, really disappointed the way the government, the Commonwealth government, only wants to really test those that have been exposed to for 4 hours. Now we know that Omicron has a really higher rate of transmission, about 36% higher even than Delta. And Delta was 60% higher than Alpha. And so you don't need 4 hours to be exposed to either Delta or Omicron. And what, if they wanted to get the cost down, they could have done was had the testing hubs with those with symptoms in one line to get a PCR, and those with not symptoms but concern that they've been exposed with a rapid antigen test, which would have been very, very small amount of money compared to PCR testing.
Mary-Louise McLaws, we do have the Treasurer, Josh Frydenberg, joining us a bit later. My last question to you very briefly, if you could ask him one thing or get him to change one thing or get the federal government to change one thing right now, what would it be?
It would be providing rapid antigen tests for free to the public so that you don't have to have a big salary or be privileged to be able to afford a rapid antigen test.